Well, we're going to follow on to what John was just talking about. And one of the things he notes in his book is that all of us, what we really want is a health span that matches our lifespan. So longevity with good health. I think that's the goal that most of us have. So the questions that we have, like, are there ways to make this happen? Can you be intentional and develop a long-term plan for optimizing health, or does it really just come down to kind of good luck and good genes? So that's a little bit what we're going to talk about today. And also, what's the connection between physical health and mental health and well-being? And joining me today are two people who are really in the trenches of this subject daily. First is Laura McGintry. She's a senior vice president with Altair Advisers, which is a concierge medical company that provides members with access to top specialists, coordination of treatment and medical records and services, travel and emergency care, and really ongoing health evaluations with a big emphasis on prevention. Now, I've had the opportunity to work with Pinnacle with clients both here and at my former place of employment. And what they do for clients is really help them organize their healthcare needs and then navigate the healthcare system. So whether you're determining the best way forward when you have a significant diagnosis, or you need to find help with depression or addiction or something like that, you're given an assigned advisor who will provide ongoing oversight of all your full healthcare needs. It's a really great service. So thank you, Laura, for being here. And Judith Weitzman is a diet coach and author of the book, How to Eat When Life Gets in the Way. I love that title. Judy works one-on-one with clients to create personalized health and wellness plans, and then she'll do everything from daily texts, calling you, in-person meetings. She's really going to stay on top of people because she's trying to help them make, a lot of times, lifestyle changes. She'll also do things like go to the grocery store with you and help you start to look at different food choices that you'll make. She'll help you think about when you go out to restaurants, what are the choices that might be optimal, and also, eating while on vacation, these kind of things. What I thought was interesting is she told me her first manager in this industry was Jenny Craig, who she's still very close friends with today. And Judy also tells me that a lot of the majority of her work really is more psychology than anything else. So we appreciate Judy being with us today and sharing some of her work. And we thought as an opening for our session, we would have each of them tell a story about how they work with clients to really give you a sense of what they do on a day-to-day basis and how they're helping people make changes about health. So Laura, I'm going to ask if we can start off with you. And I know a lot of times people come to you when they have a specific disease or something already going on. But if you can talk a little bit too about how you help people on the prevention side and the sort of ongoing health needs, that would be great.
Absolutely. And it's thanks everyone. I'm really happy to be here today, by the way. I love talking about this subject because I think it's so important, and I think that one of the things that I love most about our membership base are the people that come to us when they're just starting to think about retirement, and they are developing a plan not only from a financial perspective, but also from a health perspective. And this is when they really become interested in looking at a service like PinnacleCare. Although you don't have to have PinnacleCare to be thinking and planning for your best health in your retirement. So getting someone that is been, working a lot of years, a lot of times they don't have really good baseline information. They might not have been getting regular physicals. We see a lot of times people that come in to us, 55-year-old men who have never had a colonoscopy, things that a lot of times nobody really wants to address or talk about. But the first thing that we want to do is we want to help them to gather some baseline information to get those things done that they need to do. And what we often find is there's been sort of a fear of the unknown a lot of times. So what the advisor's role is to really work with them to get a comfort level. And I'll tell you a quick story. We had a very, very famous author who came into us and we said, well, you've never had a colonoscopy and you really have to get one. And he said, well, I'm afraid. And so his advisor, he was in New York, and his advisor made an appointment for him, and the doctor called and said he didn't show up for the appointment. And so we worked on him, and we got him another appointment, and he didn't show up for that appointment either. So the next appointment that we scheduled, the advisor actually got a hotel room next to his and watched over him all night long, did not let him leave that hotel room, made sure that he did everything, and then dragged him to that appointment the next day. And he always talks about that being the beginning of his realization of what he really needs to be doing on his own. And one of the things that he said that I thought was so telling was, this fear of the unknown is much worse than actually going and getting the testing. And so that's where we start. And then, of course, having all of that information available is the most important thing if, God forbid, you do get a diagnosis. Or we like to think that we help people from that happening as much as possible.
Great, thank you. Judy, your work's really personal and one-on-one. I know it's very individualized in how you work with people, but can you share a little bit about it?
First of all, I lost 50 pounds 37 years ago, and I've kept it off, and that's kind of my basis for a lot of what I teach my clients. And like she said, I started this business 10 years ago, and I had been in weight loss, obviously, previously when I worked for Jenny at Gloria Marshall Figure Salons and then at her own company. And what I've learned is that everybody knows how to diet, and I really think diet's a 4-letter word, and we shouldn't use it. It's really about changing your behaviors, because the people that are overweight, the behaviors they have now are the ones they've established over time, whether it be eating a lot at night while they're watching TV or whatever, or going out or socializing a lot, or being a drinker, because that can add a lot of calories. And when you asked about a story, I was thinking, I have this one couple, I've had so many different kinds of clients, and I have clients that come to me that want to lose 6 pounds, which is absurd, but they do. And I have other clients that want to come to me to lose 200 pounds. It just all depends. But this one couple in particular, they're really a treat. And they came to me, and they, actually about almost a year ago. And since then, the husband has lost 50 pounds. He just hit that last week. And the wife has lost like 25 and maintained. And they're very active socially, and they both like to drink. And I'm not judging, I don't really care what anybody does, but it does have an impact on the scale. And the thing is, they said the accountability and learning how to live their lives and eat anything they want, but just how much of it they have has been life-changing for them. Because I think that a lot of times people restrict themselves in so many ways that it's really hard to stay focused, or you feel deprived. And that's the one thing I'm constantly saying to my clients, I do not ever want you to feel deprived. But there's things that we eat to excess just because it's there. And so it's just really learning how to rewire your brain and look at food in a different way. But it can become very easy and very natural. And I have another client and most of my clients all say to me, it's really about the accountability. And my clients report in what they eat every single night, 7 nights a week. And I do go unplugged on Sundays, though. but otherwise, I'm emailing them daily. I'm texting them. In the beginning, I talk to my clients daily just to make sure till we get to know each other, and then we can pair back. But even though I'm really in their face, I do it in a very polite, kind of quiet way. And the nice thing is, we only meet in person a couple times during the first month, and then only every 10 or 20 pounds for measurements. But the rest of it's all done on phone, text, and email, which in everybody's busy schedules, that seems to work really well for them. And I have gotten really wonderful results that I'm really proud of. And I'm even more proud of the fact that I've been in my own business for 10 years. So that's kind of cool. And that's what I do. I try to make it a fun experience. And that's another thing that I get a lot of feedback on, is that this isn't hard. And I said, it doesn't have to be. You just have to tweak your behaviors so that you can eat healthy and live a better lifestyle. But I also encourage lots of sleep, lots of water, lots of exercise, but those are all just part of the whole package. And that's it.
Well, one of the things I wanted to start off our conversation with today is, a lot of what we're doing this program for is centered on sort of actively planning for happiness and fulfillment. And we all hear a lot of things about people in whatever stage of life they're in. You can decide on poor habits, and that can lead to health problems. And then I know I have this neighbor who's in his 80s, and some days when I don't feel like going to the gym, I look out and there he goes running by. He's a marathoner. I'm like, oh, God. So, but is there, and then there's all those books like Younger Next Year about like, basically picking up extreme exercise habits, in your 60s, 70s, and beyond. How do you figure out what is, maybe there's some sort of in between sitting on the couch and running a marathon, and how do you figure out what is right for you individually? Because everyone's going to have their different starting point.
My answer to that would be do something that you love, because then you'll keep doing it. If you hate going to the gym, do not make that your activity. If you enjoy going outside for a walk, make that your activity. If you like playing tennis, go play tennis. Do something you love, because then you'll continue the behavior. That's the bottom line. But you need to be active. And we were talking previous to this day, and these trackers that people are wearing that are becoming very popular are very motivational. I mean, and just tracking your steps. I mean, I'll look down. If my steps aren't high enough, I'll figure out errands I can run on foot so I can just get higher steps. Or I'll run the steps in my house just to get more steps, because it's like a challenge to hit my 10,000. I want to do that every day. And I mean, I'm happy if my clients do 7,000 as long as they're out there and they're moving.
And I think that what's really important, and what I see pretty consistently with friends, with clients, with family, is there's so many diets, as you mentioned, out there. I think everybody, it's a little bit overwhelming to say, tomorrow I'm going to change my complete lifestyle. I'm going to start on this diet. I'm not going to eat carbs. I'm going to quit drinking. I'm going to go to the gym. I'm going to go to CrossFit. And so what happens? You're never successful. When you try to do everything at once, and I've got the media really kind of, just blaring at you about all these different options. So one of the things that I think is really important is, to recognize that every single person's a little bit different. And so to kind of think within yourself, what's one thing that I can change? What's one small thing that I might want to change tomorrow? And build on that, and make it so that you don't have these goals that are out there that you just can't possibly achieve. I look at people. I have a lot of friends that are CrossFitters. They're really into extreme exercise. I have a lot of friends that feel really, really good if they got out and walked 30 minutes a day. And those are successes either way, I think. And I think that's something that people are sometimes they fight against themselves because they try to do too much too soon.
Okay. One of the things John was just talking about too, and he said the example of someone who goes from being a CEO Friday to retired on Monday. Do you guys tend to see people when they come at those different life stages too? And is it, I guess, for me it seems like, wow, I all of a sudden have all this time. I should get more exercise in. But I guess for some people too, you lose that routine of going back and forth to work and the commute and the whole, so I don't know if you see that as a time in life when things tend to get an uptick or maybe not, or how that could be spread out.
I think that's more it's individualized. Like I have one client, she's 76, and she came to me and she goes, I used to be cute and little and I'm not anymore. And I was like, poor thing. And so I said, well, we'll get you cute and little again. And the thing is that when she retired like 10 years ago, she really initiated a walking program where, she'll walk 6-7 miles in a day, which is awesome. And so she created that world for her. But I think it's very individualized. I think some people naturally create a workout kind of a plan, and other people just kick it to the curb because they were just never interested in it. Or they don't understand that some things can be exercise that aren't going to the gym. Just being naturally. You can just dance in your living room to music, and that can be exercise. It doesn't have to be organized.
Well, and I think you need to look beyond exercise too, because I think what we see with many of our clients as they go into retirement is things that are not always identified. So sometimes you see depression. That's a big thing that a lot of people don't really expect. And so recognizing that you're dealing with that, or recognizing that you're not handling something well, and seeking out resources for that can also be extremely important. And it can blindside a lot of people that have worked 18 hours a day their whole lives, and then gone from sort of 120 miles an hour to 0, and really part of that is planning, and I think that's is for your good mental health as well.
Okay, yeah. Judy, you brought this up a second ago too, is that a lot of us, we know what it is we should do. You know, eat right, get exercise. It sounds so easy. But I think it's not the knowing what to do, it's finding the motivation to do it. Your story of the man who go to the doctor, he knew he needed that appointment, but he just didn't want to go. What do you feel like when you work with clients is the motivation that helps them make those life changes?
Well, that's something you actually have to ask each individual, because everybody has different motivations, and the best one is your internal one. You're doing it for yourself and not for a wedding or not for a boyfriend or a girlfriend, or you have to make sure it's a solid goal. But to get motivated, I think success breeds success, and if I can really help them by coaching them on a daily basis on how they're eating and helping them tweak the ways that they're eating and change their behaviors, that as they see the successes, that it ramps up. The motivation just keeps going.
Yeah, I would agree with that. Success breeds motivation, for sure. And I think that there are some times where the motivation can be a new grandchild, or it can be, there can be a lot of things out there. But I do think that a lot of times what I see as the motivation is I want to live a fulfilling life after retirement, and travel and do the things that my partner and I got to talk about in our little 2-minute talk about some of these people that are retiring and going to India for 2 months, or doing some immersing themselves in new cultures. It's a wonderful thing. But again, not for everyone. Everybody's a little bit different.
Yeah. And one more point is that when I have clients that, let's say they have a rough day, I try to find the positives in every day, because everybody has them. And I even encourage my clients to write down 3 positive things that happened that day. Like if they passed up 1 cookie, that's an accomplishment. And they need to write it down and feel good about it. I mean, because the thing is, we always focus on the negatives instead of the positives. So I'm always trying to switch their brains to focusing on what they did do right, and not the things that they messed up on that day.
Yeah. I know John talked about hearing the bear in the woods. I can actually hear the ice cream truck still. It's from a little child. So those things can kind of be built in. I know, Judy, you've got your Fitbit on. Actually, one of the things I wanted to talk about was technology and how that's changing some things. I mean, my grandparents growing up, they did not go to a gym. They didn't own a treadmill, but they were both big gardeners. They worked out in the yard. If I slept as a child past like 7, they would come get me thinking something was wrong. How is technology sort of changing things, I guess for better and for worse, in terms, I know there's apps, there's all sorts of things you can do now. What do you guys see your clients doing?
Well, I would think you should go first, because
Okay,
I think
that's fine.
you have a lot of technologies that
we do. I live on technology right now with my clients. They all track in an app on their phones, because it's with them all the time and it's easy to do. And they just give me their password and their sign-in information. And when I get up in the morning, I just check into their file and see how they did, and then I can send them an email with feedback. So I definitely use that app. I encourage them to have some kind of pedometer of some sort, no matter what brand. I mean, Fitbit, Jawbone, Garmin, Misfit, there's a million, Nike, Apple phones. I mean, there's so many different ways to track. Even on your phone, there are apps you can use to track steps. But those are just natural ways of doing it. But I think the technology has made it so much easier. And I just love it. I mean, it's great. It's a love-hate relationship, but it's a really good thing.
And I would just say, speaking of technology, and not really so much from the exercise perspective, but a lot of you probably are starting to see electronic health records, if you're in one particular system or not. That's something we do, is digitize all the medical records. But things like that, really important. Again, going back to baseline information, that's where you can track also your bio, physical results, things like that, so that you really know what your markers are, and that way you can track your cholesterol and your blood pressure and your AC1 values. And it's a good time, I think, to think about that, so that you can kind of be aware of changes that you might be seeing that might require some additional support.
One more thing on technology is that having phones today, you can get any menu at any restaurant, and being able to look at a menu ahead of time and pre-planning before you go, and not being seduced by the waiter to get whatever what they're trying to get you to buy. I mean, you can go in there with a plan, and you can eat a lot healthier that way. And so just having that kind of access is huge.
That's great. That's great. And what about things, Laura? This is probably a little more directed to you, but I remember, we had client families we'd work with, people would say, well, I want a full body scan, or I want to get genetics testing so I can see if I have the BRCA gene, the test for breast cancer. I think there's one where I don't know why really someone would want it, but you can test with pretty accuracy about whether or not you're going to get Alzheimer's. I mean, and things like that. I mean, we're seeing that come up more. Is that something your clients want so they can get ahead of these games? And is that a good thing, or is it, is it too much?
I think it's a good thing in a lot of cases, because I always say everybody's different, and what's going to make you sleep at night. And that's kind of my rule of thumb with just about everything. We do have a member sort of demographic, what I would call the worried well. And I don't say that lightly, because they really are typically worried well because they had a father die of a disease, a grandfather. I have a client in London who literally had like 4 male members of his family die of colon cancer pretty early. So, he's perfectly well and healthy, but he is worried. And what we want to do is we want to make sure that we give him all of the resources that he needs to take some of that worry off his plate. Some people are not worried well. Some people just have a different approach. They are just, they're going to go into that doctor, once a year, get their executive physical, their comprehensive physical. They're going to do their follow-ups, and then they're going to feel perfectly fine. But the goal is that you have that information at your fingertips. You know what you're doing. You know what your numbers are. And that way, if you need to do something, then you're empowered to do it in a much better way.
Yeah. I am surprised at how many people don't do a regular annual physical.
And
there are people that would never miss that 6-month dentist appointment, like that they would never miss, but for some reason they don't do. And you do need those, at any age, you need that baseline of information.
You absolutely do, and you need to start looking at what kind of specialty care you need, and sometimes you want to make sure that, before your doctor acts as a cardiologist, that's appropriate. That doctor has the appropriate background. So you do need to arm yourself with a lot more information as you get older. It's not as easy. Sometimes it takes a little bit more of a team to stay healthy as you're older and you need more specialty care. But it doesn't necessarily mean you're a sick person. It just means that you're planning for your health the way you would plan for your finances.
Yeah. Actually, I want to build on this part of the conversation a little bit, that Andrew Weil says we don't have a healthcare system at all. We have a disease management system. That the whole healthcare system that we have is really built around, sort of treating diseases and in a way. And what's your response to that? Like, I know a lot of the work you guys do is keeping people healthy and preventing or getting ahead of the curve.
Well, we have, as an example, an integrative and complementary health department headed up by a naturopathic physician. And the reason for that, and I'll give my brother-in-law, he'd kill me if he were here right now, as an example. He's a very accomplished physician. If you ever ate Thanksgiving dinner with him, you would know that he has no idea what nutrition is all about. He is really clueless when it comes to a lot of things because he did not learn that in medical school. So when you go to a doctor and you're getting, primary care, you may be going to a doctor that also did not have that kind of medical training, and that's being incorporated in. So the younger the doctor, the more likely they're going to be a little bit better about that. A doctor of osteopathy is good to have as a primary care at times too. They have more of that focus. But the bottom line is that you really need to seek out resources to be able to talk to you about those aspects of your health that are more integrative in nature. I have another friend who's a surgeon that says, Laura, we're really just car mechanics. So, you really want to look for the doctor that's going to have the right background for you to address those things.
Yeah. I remember you said on the phone, you felt like insurance companies sort of run
I
the
feel like
world.
insurance companies dictate what the doctors prescribe. kind of it, yeah.
Well, it's insurance driven for
It is
sure.
insurance driven.
Yeah,
It's pretty scary.
Yeah.
I know one of the things we talked about in our calls too is sort of modern lifestyle, which has to do with technology, but also just how we live today. You know, again, my grandparents did not go out to eat, I don't think. The number of times that we do now, I don't think there was a number of restaurants where they were either, but you know, how does our modern lifestyle kind of feed into good health habits, bad health habits, you know, that kind of thing?
That is such a big topic in my world. 20 years, 25 years ago, people did not eat out as much. You know, we went out once a week. It was a really, really big occasion. You know, we were also poor. That's another story. But the thing is that people eat out much more often. A lot of people are using food services to, you know, bring in food instead of having to cook. Plus, the food industry is a lot of the reason we have obesity today, because they have infused food with salt, fat, and sugar, and made it so you want to keep craving more. Actually, Dr. David Kessler wrote a book called The End of Overeating, which that's what it's all about, how the restaurants and the grocery stores. I mean, we have a category in grocery stores now for snacks. We didn't have organized snacks when I was a kid. You know, you ate an apple, you know, you ate an orange, or your mother baked cookies. You know, you didn't like go and buy all this stuff. And the portion sizes are just ridiculous. Restaurants, I guess they think that, you know, if they give you a plate of pasta for $6 and that's your entree, I mean, they think that's cool. Well, no, you know, that's not good at all. And if they give you like a small amount, you think you're getting ripped off, because that's how our brains have been trained. And so a lot of it is just what's being thrown at us. And we have to kind of rise above it and make our own choices. But I mean, a perfect example is a bagel used to be the size of a small tuna can. Now it's the size of your head. You know, I mean, it's just ridiculous. So, I mean, one bagel, I mean, like a plain one's like 300 calories or something. If you put sesame seeds on it, it goes up 100 calories because of the oil in the sesame seeds. I mean, that's just abominable. And so, I mean, the new skinny bagels is there's a lot of great concepts out there, like the 100-calorie packs are great. But the problem I find with 100-calorie packs, they're too easy to justify. So you might have 5 of them in an evening over time instead of just one. And so there's lots of things that are sabotaging us that really are kind of out of our control, but we can find ways to work within it.
All right. Well, I want to save a little bit of time at the end, because like John just had us do, we're talking about role models and retirement. One of the things we thought would be fun is if everybody, you know, we all have pen and paper, if everybody took a minute to think about 1 or 2 things that they could do in the short term to change your health. So, and that's realistic. You know, again, like Laura says, like, well, I'm going to go, you know, gluten-free tomorrow and hit the gym and run a marathon by the end of next month. Maybe, you know, depending on where you are. But if you could write down 1 or 2 things that you want to think about for your health. And at the end of the program, that's actually going to be part of what John incorporates into sort of the different, you know, those 3 circles and the different ways we think about their life. But so I'm going to give everybody like 2 minutes to do that. And then we'll come back, and if people have questions and answers, we'll do that, and then we'll take our break. So a couple minutes. Something very realistic that you could do this week if you wanted to. That didn't require anything extreme. From the volume in the room, I think people have gotten their 1 or 2 things down. So I'm going to give everybody, does anyone have any questions they want to ask for our panelists? Because I'm going to ask them for sort of their parting thoughts and like what they want us to remember as they walk away. But yes?
Other than fruits and vegetables, what do you recommend as good things to snack on?
Okay, the question was, other than fruits and vegetables, what would you recommend as good things to snack on? Judy?
That's a good one, because those are definitely my first choices. Okay. It's all about portion control. I really believe you can have anything in the world you want. I mean, that's actually, you know, but it's having stuff like maybe popcorn, but like air popped without all the fat and oil in it. Or other ones. I mean, you can have like, it just depends. I mean, you can have other things like, let's say, some hummus with your vegetables or something, but you have to watch how much of it you have. So you can really have anything you want to snack on. I have a lot of people that are into protein bars and stuff like that, which I have mixed emotions on. But if you're really hungry, but I believe in only eating half a bar at any time and putting the other half away, because most of them are 200 calories, and that's too much for a snack.
On that, there was a speaker
Well, protein does do it. You're right. Protein's a really good thing. No, another favorite, I'm glad you said that, because another great one is if you take like a slice of turkey and wrap it around a pickle, that's a great snack. It's a good power hit.
Yeah.
And something like that, or even wrapping it around a cheese stick would be a good thing.
But not getting too hungry, I think, too, is part of your point. If you wait forever, the apple doesn't seem like that great of a snack, you know.
No, but
so you're
having
gonna,
protein, hard-boiled eggs are good. And actually, one of my favorite tips is if you take hard-boiled eggs and you pitch the yolk, because the white's only 17 calories. You put a teaspoon of hummus on each side. You have like little hummus eggs. They look like deviled eggs. The texture's amazing. They are so filling. They're only 52 calories. I eat one before I go out to dinner to take the edge off, so I don't want to eat the whole bread basket when I sit down, or the tablecloth, depending on how bad it is. You know, that kind of a thing. Yeah.
Ms. McGintry, I have access to a major medical system here. I get a regular checkup. I have an internist who can refer me easily to the next specialist or test that I need. I do access my tests in their system, so I pay attention to it. I'm curious about these executive concierge systems. Given my circumstance, what would I gain by one of those?
Yeah, yeah.
Could you guys hear that question?
Yeah,
He was saying, yeah, okay, it's hard to hear. He was saying he already takes good care of himself. He has, you know, good health care here. He has, you know, does tests on a regular basis. So what it would be, what's the benefit of working with the concierge medical group?
Yeah, and it really depends on your lifestyle and what you're doing. So if you're traveling a great deal, you might want to be looking at that as far as risk management, making sure that you have a good plan for that. If you're already accessing really good medical care, the one, and I do love concierge doctors. I think they're great just because if you want somebody that's going to spend a little bit more time with you, some people have regular doctors that do that already, but in today's healthcare system, not all the time. So the concierge model, in case anyone's not familiar with it, for an internal concierge physician practice is that doctor reduces their practice size. They charge a fairly small amount on an annual basis. You get some extra amenities. It's not what we do at PinnacleCare, but we find a lot of our members come in and they already want that concierge model for their internists because they get better care that way and a little more attention. Where you want to look at the difference between a comprehensive physical and an executive physical, a lot of times that's a timing perspective. For somebody that has a really, really busy career, it might be easier for them to go into a one-day program at a Mayo or a Cleveland Clinic or a Northwestern and go through one day of testing. I call it soup to nuts. It's everything from ophthalmology to podiatry, and get it all done in one fell swoop. Thirdly, I think it's really, really important when you if you do have a diagnosis and you've been within one particular medical system for your entire time and you have all those medical records, and that's great, I always say seek a second opinion and seek an opinion outside of that particular medical system, because you always want to get different perspectives. We have a saying at PinnacleCare, medicine is much more of an art than a science, and that is true for just about any diagnosis. You want to get different perspectives before you decide on a path for treatment. So great question.
Any last questions? Oh, Matt?
Yeah. You mentioned drinking, like you're a big fan of water, drinking water, and there's a lot of things I've read that talk about having the water before you start eating.
Absolutely.
Is that something you recommend?
I actually recommend it. And it's been proven in a lot of testing that if you have 2 glasses, and a glass like an 8-ounce glass is not that big, or this is probably about that, but anyway, this is probably more like 12. But if you have 2 8-ounce cups of water before you eat, you get a false full, and then you don't eat as much, which is a good thing. And I actually, to tell a quick story, I had a client that came to me to lose a small amount of weight, but she was struggling. She couldn't get like the last 4 or 5 pounds off. And I was asking her about her water. She said, yeah, I'm drinking. I said, no, I want you to track it. And when she started drinking more water, like more like 10 to 12 glasses a day, her weight just started falling off. And so it really does help to keep, it helps your whole body to stay more lubricated. I mean, you're 80% water anyway, so it's, or 70%, but it keeps your body moving, and I live on water. And by 9 in the morning, I mean, I start at 5 in the morning, but by 9, I've got 48 ounces down. And I also believe in doing a lot when you're still home, so you're close to a bathroom. It makes a big difference in your lifestyle. And you don't want to do it too late in the day because you don't want to be up all night going to the bathroom. So you have to be kind of logical about it. I mean, I know where every bathroom is within 5 miles of my house because I drink so much water, but you just have to keep things in perspective. But it is a really good behavior. And drinking water instead of other sugary drinks or coffee drinks or anything else, or Diet Pop, which is my greatest pet peeve in the world, water is your best friend.
And as we get older, we're supposed to take in more water, isn't that?
You're always supposed to drink
Okay.
more water. I push my granddaughter at 2.5 to drink more water. We have water contest.
Obviously, the flavor of carbonated water has become very popular.
That's fine.
A
I don't care as long
LaCroix,
as you're drinking
yeah,
water.
the
I don't care if
flavored
you flavor it,
carbonated.
if you put fruit in it. Use a little. You don't need a whole thing of Crystal Light. Those packets, just like about a half of it, just to give it some flavor. I have no problem with that. You can drink iced tea for part of your water. Plain water is your best bet, but if you have trouble with that, go with like a light iced tea or something.
Okay. Well, before we end and take our break, I wanted each of them to just kind of give us, a few last words of wisdom, people on the way out. One of the things I like to think about health that I've thought about for a long time is I actually think being healthier is a lot of little decisions all day long. It's not like a one big thing, but it's just like, what are your little decisions throughout the day? So that's sort of one thing my mom or my grandma, someone gave me that along the way. But yeah, that's one of the things I take with me.
Yeah, and I would agree. I think it's instead of really being sort of party to all of the media frenzy, diets don't work. I think we all agree with that. And so instead of going out and, embarking on something that's sort of impossible and hard to achieve all at once, just pick a few small things. One small thing tomorrow can lead to a lot of things down the road and some better success. And then I, have to say, be sure that you're getting your annual checkups, that you're going to a reputable physician, and that you're following up with any recommendations that are made. And I think that that's an extremely small thing to do, but it's something that a lot of people don't do enough or on a regular basis. So that would be a good thing to do.
I have a couple parting things. Number one, I believe you can eat anything in the world you want. It's just how much of it you have. And you just want to chip at one behavior at a time and just keep changing your behaviors till you get into a healthier mode. And try not to ever feel deprived because that will drive you down a bad path. And I think I had one more, but I can't think of it. Okay, I think that should do it.
Great. Well, thank you, Judy and Laura, for being here. We really appreciate it.
Thanks for inviting us.
We're going to take a 15-minute